Hi there, I'm Dr. Barb Frackowiak. I'm an orthodontist with about 30 years experience, and orthodontics is something that I do as a full-time passion, not one of my many services. So for the first 20 years I did pretty much traditional orthodontics, which is braces and wires, and then extracting teeth as required. Then I wasn't quite happy with the status quo, started doing some research, and for the past 10 years have been practicing what's called Airway centered orthodontics. So that's a technique that's being practiced around the world in about 30, 40 countries, and it's been around for over 30 years, but relatively new to North America. So Airway centered is a technique that focuses more on growing the face and the jaws, making sure everything fits together, and growing the mouth to fit the teeth, as opposed to traditional orthodontics where you would usually wait for most of the permanent teeth to be in. But that means that in the meantime the face and the mouth have grown incorrectly. Then you have to start taking out teeth to try to get everything to fit together properly. So not only does Airway centered very often, well, even most of the time, mean that you don't need extractions, but it will lead to better aesthetics. It will build a better foundation so that there's room for the teeth, and it can lead to much better health, because when the airway is the right size, we're breathing properly. Proper breathing, meaning nose breathing, means we have better brain development, better focus, better concentration for academics, and better performance in sports.